watching Eagle News America. I'm Ace Ramirez, coming to you from Washington, D.C. It's Wednesday, April 14, 2021. We have updates from our correspondents across North and Latin America. May Davila in Ciudad de Panama tells us about Panama easing restrictions with shorter curfews and longer business hours. Eliza Gonzalez Manglikmot reports about DC's rent and utility aid for struggling district residents. Mila Simbulan in Swarthmore, Pennsylvania.
All Pennsylvania adults are now eligible to receive COVID-19 vaccine. And Pennsylvania Department of Health launched the first statewide COVID-19 mobile vaccination clinic tour for minorities and underserved communities.
May Ann Manzano Guerzon in Sicklerville, New Jersey.
Governor Murphy, over 244,000 Johnson & Johnson vaccine administered in New Jersey. No similar adverse effects reported.
Rani Bayuga in Parisburg, Ohio.
Pause on J&J vaccine closes several Ohio vaccination sites. And H2O Ohio creates wetlands.
In Grand Rapids, Michigan, Lou Aquino.
Michigan Health Chief warns of COVID-19 surge.
In Edmonton, Alberta, we have Thomas Likeness.
Ontario's premier is sheared like a sheepdog as hairstylists in his province remain closed.
Today is National Gardening Day. EBC friend Jim Sewell will share with us some gardening do's for beginners. Plus, for tonight's roundtable, it's Veggie Talk. Our coverage begins now. Some 20 children aged 3 to 5 years old died Tuesday after several classrooms caught fire at a school in Niger's capital, Niamey. Fire Service Commander Sidi Mohammed says 21 classrooms in straw huts caught fire and the children were trapped in the blaze. Although the fire was rapidly put out, its power was enormous. The children were not able to escape. Public television, citing witnesses, said the fire had broken out at a time when the victims were in class. The cause of the fire was not yet known. Prime Minister Ouhamadou Mahamadou traveled to the scene of the tragedy on the edge of the capital to offer his condolences to the children's parents. Niger ranks as the poorest country in the world under the UN's 189-nation Human Development Index. Authorities in the Sahel country have built thousands of straw huts to serve as classrooms, with children sometimes seated on the floor. Fires in these buildings are fairly common due to the flammable materials used, but such accidents have rarely been fatal. Meanwhile, President Joe Biden announces it's time to end America's longest war with the unconditional withdrawal of troops from Afghanistan, where they have spent 2 decades in a bloody, largely fruitless battle against the Taliban. Dubbed the Forever War, the U.S. military onslaught in Afghanistan began in response to the September 11, 2001 terrorist attacks against the United States. Now, 20 years later, President Biden is naming September 11 as the deadline by which the last U.S. soldiers will have finally departed. The internationally backed government in Kabul has only tenuous control in swaths of the country, while the Taliban are growing in strength, with many predicting the insurgency will seek to regain total power once the government's U.S. military umbrella is removed. Top Democratic Senator Chuck Schumer said Wednesday, America does not need to fight forever wars. Commenting on President Joe Biden's decision, White House Press Secretary Jen Psaki says the terrorist threat has evolved.
The president asked for a review from his national security team. He asked them not to sugarcoat it. He welcomed ideas, welcomed differences of points of view, and he was provided with a clear-eyed assessment about the best path forward. So as a part of his assessment and decision-making, part of the discussion was around the fact that the terrorist threat has evolved. We can't look at things through the 2001 mindset. We have to look at things through the 2021 world. So we will be monitoring our administration, our national security teams in partnership with our NATO allies and partners in the region, We will be monitoring, of course, and disrupting and focused on disrupting terrorist networks and operations that have spread far beyond Afghanistan.
There was immediate criticism from some quarters that the United States is abandoning the Afghan government and encouraging jihadist insurgencies. Senior Republican Senator Mitch McConnell said this move is helping America's adversaries ring in the anniversary of the 9/11 attacks by gift wrapping the country and handing it right back to them.
The administration has decided to abandon U.S. efforts in Afghanistan, which have helped keep radical Islamic terrorism in check. And bizarrely, they've decided to do so by September the 11th. Apparently, we're to help our adversaries ring in the anniversary of the 9/11 attacks by gift wrapping the country and handing it right back to them. Unfortunately, this mistake in Afghanistan is one of several instances of this new administration surrendering leverage without making America, our allies, or our interests more secure.
Afghans react to the planned withdrawal of U.S. troops by September. The announcement will bring relief to those who want the war to end, but fear to many who live on the front lines. Let's take a look.
Living in a time line where we are not anywhere with the negotiations, or we haven't received an agreement with the Taliban, would not be responsible, and it would can cost us losing everything we worked and fought together in the past 20 years, and that can risk overall security in Afghanistan. So that's why I think the extension is a responsible approach for what's happening here now in Afghanistan.
خارجی ها هستن، یک روزی باید برن، یک روز آمدن، یک روز هم باید برن و ما نباید متکی به آنها باشیم. بالاخره اونا امروز نرفتن، فردا میرن، 4 ماه بعد نرفتن، 6 ماه بالاخره رفتنی هستن. و ما یک رقم حکومت ما وابسته به خارجی ها نباید باشه. بالاخره یک روزی خارجی هستن و نباید اونا اینجا باشن و ما باید مستقل باشیم، متکی به نیروهای دولتی و نیروهای امنیتی خود باشیم. هیچ وقت بودن آنها در افغانستان مثل یک مسکن میمانه، مثل این میمانه که یک دوای موقتی است.
و من حیث یک شهروند افغان و من حیث یک دختر افغانی که فعلا حداقل در زمانی که حکومت قدرت را داره، حکومت رسمی قدرت را داره، میتونم راحت درس بخوانم، میتونم راحت در جامعه کار بکنم. اگر یه اتفاق بیفته و نیروهای آمریکایی خارج شوند، جنگ داخلی شود یا که حداقل حکومت به شکل به دست طالبان بیفته، فکر میکنم که این چانس نخواهد داشتم. حتی شاید نتونم که از خانه بیرون شوم، یا اینکه راحت درس بخوانم، یا اینکه بتونم در اجتماع فعالیت کنم.
نیروهای آمریکایی به خاطر از این باشن، به نظر من که مملکت ما نارام است، جنگ است، مردم بیچاره است. یعنی آمریکایی است که امنیتش گرفته، یعنی دولت ما ضعیف است، بیچاره چیز نداره. طالبا بیاید، ما نمیگیم که نبیاید، با اون شکل نبیاید که بعد سابق یک ساسر بیچاره یک دستمال یک چادر در سرش نمی بود، او را قمچین کاری میکرد. مردم بیچاره و غریب میزد، لطکوب میکرد، برو ماجد، برو دکان تا بسته کن، برو نماز بخوان. با این شکل که بیاید نبیاید. اگر میاید صحیح بیاید، مثل که ما زندگی میکنیم در این شهر، یا ما تو زندگی کنه صلح‌آمیز.
For today's COVID-19 numbers, according to the Coronavirus Resource Center of Johns Hopkins University in Medicine, as of 6 p.m. Eastern Time, Wednesday, April 14, the number of cases of COVID-19 reported worldwide is now over 137,811,000. Top 3 on the list of countries with recorded cases: U.S. has over 31.3 million, India with over 13.8 million, Brazil over 13.5 million. To date, more than 2,965,000 have succumbed to this virus. The U.S. leads the countries with the most number of COVID-19 related deaths with over 563,000. Brazil is next with more than 358,000, and Mexico has more than 210,000. Now for COVID news, Chief Ursula von der Leyen says the European Union is turning more heavily to BioNTech Pfizer to make up for suspended Johnson & Johnson vaccine doses and for longer-term needs to fight the mutating coronavirus. In a televised statement, she says BioNTech Pfizer is bringing forward delivery of 50 million doses to the second quarter, starting this month, to help make up for the shortfall of the J&J jabs that were meant to start rolling out.
Of these 100 million vaccinations, more than a quarter are already second doses. That means that we have now more than 27 million Europeans fully vaccinated. And this is good news. But as we can see with the announcement by Johnson & Johnson yesterday, there are still many factors that can disrupt the planned delivery schedules of vaccines. We are now entering into negotiations with BioNTech Pfizer for a third contract. This contract will foresee the delivery of 1.8 billion additional doses of vaccine over the period of 2022 and 2023.
The European Union had a sluggish first quarter rollout mainly because of vaccine supply constraints, especially by AstraZeneca, which delivered less than a quarter of the 120 million doses it had promised. In Panama, beginning April 19, curfew will be cut shorter and business hours extended. This story and more about COVID variants detected in the country from Eagle News correspondent May Davila. May.
The Ministerio de Salud announces that as of next Monday, April 19, the curfew throughout the country will be from 12 midnight to 4 in the morning. Businesses will be allowed to open until 11 p.m. for a greater opportunity to serve clients. The public will be allowed to attend outdoor sports activities with a capacity of 25%, but without sale of liquor. Also, as of Monday, April 19, the molecular COVID-19 test will be mandatory at the Tocumen International Airport, which is more specific with a lower margin of error for all travelers entering the country. The isolation process for all travelers from South America will be reduced from 5 days to 3. Because of the epidemiological and genomic surveillance that MINSA has maintained in all the entrances to the country, 4 strains and variants of the new coronavirus have been detected in Panama. These are the South African, Brazilian, United Kingdom, and Californian variants. According to MINSA, these variants are more contagious. Of the 15 cases detected in Panama with the new strains, a total of 13 people have recovered. Case 14 is a patient who is in hospital, and case 15 is in the intensive care unit. The MINSA recalls that since the enforcement of the Executive Decree number 260 of March 29, 2021, which establishes that every person from South America must bring a negative PCR or antigen test and perform another at their own cost, 3,943 travelers have passed through. Of the 3,943 travelers, 28 have been infected with COVID-19, despite having a negative test when arriving at the Tocumen International Airport. In addition, 11 travelers had a positive test after having completed the 5 days of regulatory quarantine, and the rest have completed quarantine without presenting respiratory symptoms. Desde Ciudad de Panama, May Davila, Eagle News. Vivimos en tiempos interesantes.
Thank you, May. When we come back, updates from Washington, Pennsylvania, and New Jersey. This is Eagle News America. Stay with us.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
watching Eagle News America. I'm Ace Ramirez in Washington. EBC's Elias Gonzalez Manglikmot tells us about DC's Rent and Utility Assistance Program, recently launched for struggling residents due to the COVID-19 pandemic.
If you are a renter or housing provider in the District of Columbia who is at risk or has a tenant at risk of not paying rent or utilities, then you may qualify for the Stay DC program. What is Stay DC? The Stronger Together by Assisting You or Stay DC program provides financial assistance to DC residents struggling to make rent and utility payments due to the COVID-19 pandemic. Mayor Muriel Bowser launched Stay DC on Monday to benefit struggling renters and housing providers through a grant funding that covers past and future rental payments in addition to utilities like water, gas, and electricity. Mayor Bowser says a strong recovery begins with ensuring everyone in the community has safe and stable housing. This is about getting Washingtonians the money they need to pay their bills now so that they can stay in their homes once the public health emergency ends. Bowser thanks the Biden administration for recognizing the need for this investment and providing the resources necessary to address unprecedented levels of housing instability. Now, how do you qualify for Stay DC? First, you must be a renter or housing provider in the district who is at risk or has a tenant at risk of not paying rent or utilities on a residential dwelling. Now, there is also a set cutoff on the annual household income as set by the U.S. Department of Housing and Urban Development. It may not exceed designated levels according to household size. So let's say, for example, a family of 4 must make less than $82,300 per year. Now, if you meet these qualifications, eligible households may receive up to 12 months of assistance going back to April 1st, 2020, and 3 months of assistance for future payments at a time for a total of 18 months of assistance. Now, where do you go to apply? Renters and housing providers can begin submitting applications for rental and utility assistance today at stay.dc.gov. Applicants can call the Stay DC call center at 833-4-STAY-DC for support throughout their application process, Mondays through Fridays from 7 a.m. to 7 p.m. Residents who opt to submit paper applications can work with community-based organizations. Stay DC replaces the district's COVID-19 Housing Assistance Program, or CHAP, and will augment the Emergency Rental Assistance Program, ERAP, and Low Income Home Energy Assistance Program, or the LIHEAP. Now for some weather update here in the nation's capital, it is currently 60 degrees Fahrenheit or 16 degrees Celsius. In Washington, Eliza Gonzalez Manglikmot, Eagle News, will live in interesting times.
All adults in Pennsylvania are now eligible to receive the COVID-19 vaccine. In Swarthmore, Bureau Chief Mila Simbulan has this story and more.
That's right, Ace. Governor Tom Wolf and the COVID-19 Vaccine Task Force announced that effective Tuesday, April 13, all Pennsylvania adults will be eligible to schedule an appointment for the COVID-19 vaccine. The Department of Health noted that there is ongoing appointment availability in many parts of the state, even as Phase 1A and B continue and 1C began yesterday. With the change in eligibility, those in Phase 2 will become eligible, opening up vaccines to all. The ongoing initiative with the area agencies on aging to provide assistance to vulnerable seniors for accessing vaccine will continue, as with other equity initiatives. To date, Pennsylvania providers have administered more than 6 million vaccines, and the state is ranked among the top 20 states for first dose vaccination. More than 2.4 million Pennsylvanians are fully vaccinated. Meanwhile, Pennsylvania Department of Health, in partnership with the Latino Connection and Highmark Blue Shield, launched the first statewide COVID-19 mobile vaccination clinic tour to provide vaccinations and education targeting minority and underserved communities. Here's Acting Secretary of Health, Allison Beam, to tell us more. Take a look.
The month of April is a critical turning point in this pandemic. Starting tomorrow, all Pennsylvanians ages 16 and older will be eligible to schedule a vaccine appointment. We're also launching the first statewide mobile vaccination and education tour to help reach people where they are. Now, all adult Pennsylvanians who want a vaccine can get one, and mobile units will provide another vaccination opportunity.
Latino Connection will use mobile units to conduct a statewide vaccination and education tour. One unit called CATE, or Community Accessible Testing and Education, was used in fall 2020 for a mobile COVID-19 testing tour. All units are equipped to conduct COVID-19 vaccinations on site through a mobile vehicle while educating the public on how to stay healthy and safe. This is the first statewide dedicated vaccine mobile clinic in Pennsylvania. A total of 120 mobile vaccination events will take place across the Commonwealth over the coming months. Social distancing and masking guidelines will be followed at all times at each tour stop. Additionally, 100 educational tabletop events will take place in corner stores and bodegas in key locations where individuals who do not have access to the internet or who are in need of assistance will be able to pre-register for a vaccination event in person and will be provided with educational materials in both English and Spanish. A mobile vaccination clinic is another great program in getting more shots in arms and will truly help so many Pennsylvanians. Right now, here in Swarthmore, it's 57 degrees Fahrenheit or 13 degrees Celsius with rain. In Swarthmore, Pennsylvania, Myla Simbulan, Eagle News, we live in interesting times. Back to you, Ace.
That's great news indeed, Myla. 100%. All-out vaccination campaign for Pennsylvania.
Exactly, yes.
But now that the adults are eligible, all adults are eligible for the vaccine. Are you planning to get the vaccine?
Well, actually, Ace, I've been trying to get an appointment since last week, and it was so hard. And this morning, I just tried one hospital near me, and luckily, or fortunately, I was able to get an appointment. So next week will be my first shot for, I think, the Pfizer one. So yes, I'm looking forward to that, to Tuesday to get my first shot of the vaccine. Ace?
That's great news. You and your husband, I suppose?
Yes, yes.
That's great. If I'm from Pennsylvania and I want to take advantage of the mobile vaccination tour, how do I register?
So Ace, beginning next week, those who want a vaccine can visit Facebook or www.facebook.com/Kate Mobile Unit, or they can visit katemobileunit.com so that you can pre-register for any upcoming vaccination event near you. And there will be there will be a total 120 mobile vaccination events that will take place across Pennsylvania over the coming months. And it will be added to the website. Whenever there's a confirmation, it will be added to the website. Of course, social distancing and masking, all those things will still take place. And for those individuals who do not have access to the internet, or if you need an assistance when it comes to registering, you will be able to pre-register for a vaccination event in person during one of those, they call it educational tabletop events. There will be actually 100 of those that will take place in corner stores and bodegas in some key locations here in Pennsylvania. And they will be provided actually with educational materials in both English and Spanish. Ace?
Thank you so much, Myla Simbulan, Swarthmore, Pennsylvania.
Thanks, Ace.
In New Jersey, the government's pause on the administration of Johnson & Johnson COVID-19 vaccine does not affect the state's vaccination eligibility expansion. Mayanne Manzano-Guerzon joins us tonight with the details. Mayanne.
Thank you, Ace. Over 244,000 J&J vaccine administered in New Jersey prior to hitting pause. and no adverse effects have been reported, according to Governor Phil Murphy in his COVID briefing earlier today. New Jersey Department of Health announced its decision to pause the administration of J&J or Johnson & Johnson vaccine across all vaccination sites in the state on Tuesday, following the guidance released by the CDC and FDA concerning the 6 cases of blood clots after receiving the J&J vaccine. All New Jersey vaccination sites have been told Tuesday morning to cancel or put on hold appointments for the J&J vaccine until further notice. Take a look.
Now, I must start by reiterating our announcement from yesterday of our decision to temporarily pause the administration of Johnson & Johnson's vaccine upon the recommendation of the Centers for Disease Control and Prevention and the Food and Drug Administration, pending further investigation into 6 reported instances of severe blood clots following vaccinations. Now, for sure, these 6 cases each appear to be extremely rare and serious, as there have been nearly 7 million doses of the Johnson & Johnson vaccine administered nationwide. And in New Jersey, where we had administered just over 244,000 doses of the Johnson & Johnson vaccine prior to hitting pause, no similar adverse effects have been reported. Even with this pause, our overall goal of vaccinating 4.7 million adult New Jerseyans by the end of June remains not only in place, but entirely achievable. As of today, doses of Johnson & Johnson have accounted for only about 4%, Judy, of the more than 5.6 million total vaccine doses we have administered. I want to repeat that no one who has received this vaccine should panic or worry. This review by the CDC and the FDA is coming out of an abundance of caution. Moreover, this review is critical to our efforts, both statewide and nationwide, to ensure confidence in our vaccination program and in the vaccines themselves. I will ask, if it's okay with her, Judy, to speak further to the work of the department in light of the CDC and FDA recommendation and how she and her team are working with our vaccination sites to assist those who were scheduled to receive the Johnson & Johnson vaccine. But it bears repeating that there have not been any similar reported adverse effects with Johnson & Johnson's vaccine in New Jersey, nor have them been, by the way, from either the Pfizer or Moderna vaccines.
The governor also said that the pause has no effect on Monday's opening of vaccine eligibility of all New Jerseyans 16 years old and over, and vaccination will continue to push forward with tools available to the state. For New Jersey's latest COVID-19 numbers, the Department of Health has reported another 2,828 new positive cases today, bringing our statewide total to 845,201. Sadly, we are also reporting 43 new confirmed deaths, pushing the total to 22,414 fatalities. On the brighter side, the latest total of fully vaccinated people in New Jersey is now 2,292,316. To know the latest on New Jersey's vaccination progress, visit covid19.nj.gov/vaccine. And Ace, for quick weather updates, currently 10:09 in the evening here in New Jersey, and it's currently cloudy. It is 55 degrees Fahrenheit or 13 degrees Celsius. In Sicklerville, New Jersey, May and Manzano Garzon, Eagle News, we live in interesting times. Back to you, Ace.
So just like Pennsylvania, New Jersey is going for 16 and above, all adults 16 and above, correct?
Right, correct.
Right, I'm pretty sure there are a number of people who opted for the J&J vaccine because of the fact that it's only one shot compared to Moderna, Pfizer, right? So what's going to happen to those people who are scheduled to receive the J&J jab?
Well, Ace, according to New Jersey Department of Health, for those individuals scheduled to receive the J&J vaccine, or like what you said, who opted to receive the J&J vaccine, the department will work with all the vaccine sites to make arrangements for the administration for an alternative 2 doses. And of course, we know that that's either Pfizer or Moderna, and is needed to reschedule vaccination appointments. Ace?
Okay, so big question is, what's going to happen to the inventory of the J&J doses?
Interesting, Ace, because it's actually reported by the Health Commissioner of Department of Health of New Jersey, Judy Percy Kelly. She said that all vaccine sites in NJ have taken J&J vaccine doses out of the inventory. Of course, that's to be expected. And the plan, according to the Department of Health, is that they will not be used until further federal guidance from authorities, and that the department has requested all vaccinators to maintain the existing J&J vials and appropriately monitor the storage and the conditions, and also it has to be segregated from the rest, and that we will not receive any J&J vaccine until further notice. Ace?
That's great reassurance. Thank you so much, May Ann Manzano-Gorzon, Sicklerville, New Jersey.
Thank you, Ace.
Up next, updates from Ohio, Michigan, and Edmonton, Alberta. Eagle News America will return shortly.
Hey there, Arnie Aquino here at Hatley Castle, one of the filming locations for the X-Men series. Don't forget to tune in to Digital Nest only on Net 25.
Look to NHK World Japan for news of the coronavirus outbreak across the globe. You'll find updates and insights in the specialized section of our website. Catch up with programs on your schedule through the free video on-demand service. Learn how to stay in shape and maintain your health deliciously. Ready when you are. NHK World Japan.
Eagle News America, I'm Ace Ramirez in Washington. Several vaccination sites in the state of Ohio temporarily shut down after administration of the Johnson & Johnson vaccine was halted Tuesday. In Pearisburg, Randy Bayuga has the details.
Thank you, Ace. Governor Mike DeWine paused J&J vaccinations yesterday following the FDA and CDC recommendations. The J&J vaccines were primarily distributed through the mass vaccination clinics and 63 public and private colleges and universities. Some locations will pause vaccinations entirely, and others will continue to distribute the Moderna and Pfizer vaccines. Also in Ohio, H2 Ohio. Since 2010, Buckeye Lake has been experiencing algal blooms. Today, Ohio Department of Natural Resources Director Mary Metz and Governor Mike DeWine announced details to address this issue. In 2019, Governor Mike DeWine launched H2 Ohio to address water issues by buying up land and restructuring old water infrastructure. Governor Mike DeWine stated today, reversing this damage will take time, but we must begin implementing long-term solutions now so that we can enjoy the lake in the future. By rerouting Murphy's Run, a tributary to Buckeye Lake, to a newly constructed wetland, they will be able to filter off the fertilizer-rich runoff water from the farms. The wetland will then empty to the lake with cleaner water. A second wetland will also be built to capture additional sediments and address overflow due to storms. Director Mary Metz states, we must address the underlying issues that are impacting water quality if we are going to ensure that Ohioans have access to good, clean water. Other Ohio projects, H2 Ohio projects are already underway as the organization continues to encourage agricultural best management practices, restoring wetlands, and ensuring water quality. So far in Ohio, there are now 1,045,945 confirmed cases of COVID-19. In the last 24 hours, 2,219 were added. And the total deaths so far is now up to 18,917,000. In the last 24 hours, 0 were added. Total vaccinations in Ohio is now at 4,206,856. That's about 36% of Ohio's population. Perrysburg, Ohio. Ronnie Bayuga, Eagle News. We live in interesting times. Back to you, Ace.
Randy, tell us more about this algal growth. What is the primary cause of this algal growth?
So what we're having here is the algae is growing because of the runoffs from the farms. So the farms have fertilizer in the ground, and this fertilizer is rich in nitrogen, phosphorus, and other things that's good for plants. But so once it gets to the lakes, like we had an issue in 2011 here in Toledo, Ohio, where we had algae bloom growing near our water source in Lake Erie. So this is the kind of problems that we're having. So we couldn't drink that water. So apparently not just Lake Erie, but other lakes in Ohio were affected. So they are trying to clean it up by rerouting these tributaries or the sewage, upgrading the sewage system, rerouting to now they're building wetlands, because in the wetlands, they can actually be more helpful by producing wetlands instead of creating another facility to take care of the runoff waters. So this is what they're trying to do to address these issues.
I see. So how much of an issue is this algal growth in the lakes of Ohio?
It was pretty bad with Toledo. We couldn't drink our water. We couldn't drink our water for a few weeks just because of the algae, and that is actually poisonous to us.
I see. All right. Thank you so much, Randy Bayuga, Perrysburg, Ohio. Meanwhile, in Michigan, public officials fear a possible surge of COVID-19 infections and remind residents about what not to forget to help lower down the numbers. In Grand Rapids, Eagle News correspondent Lou Aquino has the details. Lou.
Thank you, Ace. Here are the most recent numbers of COVID-19 in Michigan. There are a total of 764,519 confirmed cases, a total of 16,619 deaths, and 7,955 daily confirmed cases. These numbers show that COVID-19 situation in Michigan is reaching an alarming level. According to Dr. Johnny Caldoun, the Chief Medical Executive of Michigan Department of Health and Human Services, we are on track to potentially see a surge in cases that's even greater than the one that we saw in the fall. In today's briefing to update the COVID-19 situation in Michigan, Governor Whitmer did not implement any new restrictions, but asked residents to take voluntary actions for the next couple of weeks. She said that Michiganders have the tools that can be used to fight COVID-19 without new restrictions, and these are masking up, social distancing, and getting vaccinated. She added that Michigan still has some of the strongest protocols in place, such as capacity restrictions and a mask mandate, while other states have dropped all of these things, and yet Michigan still have a high numbers of COVID-19. According to Governor Whitmer, the reason why Michigan's numbers are so high is a combination of more contagious variants, residents without antibodies, and how much Michiganders comply with the implemented policies. Governor Whitmer made some recommendations to lower the numbers. She's asking Michigan high schools to return to remote learning for the next 2 weeks. She also called on youth sports to voluntarily suspend games and practices over the time period. Indoor dining is also one of the activities Governor Whitmer asked Michiganders to avoid for the next 2 weeks. When it comes to vaccinations, Michigan has administered more than 5.4 million doses of the COVID-19 vaccine to more than 3.4 million residents. Governor Whitmer said 41.9% of Michiganders ages 16 and up have gotten at least their first dose of vaccine, and 27.5% are fully vaccinated. In addition, about 61% of seniors are fully vaccinated. Michigan is continuously administering vaccinations, but have temporarily paused the use of Johnson & Johnson vaccine after reports of a few rare instances of blood clots forming in U.S. citizens who have received that vaccine. The decision comes after the FDA and CDC both recommended a temporary pause while those cases are investigated. In Grand Rapids, Michigan, Lou Aquino, Eagle News, we live in interesting times. Back to you, Ace.
Lou, tell us, why are the restrictions being recommended as opposed to being mandated?
Yes, so Governor Whitmer said that the spread of COVID-19 isn't due to policy problems, but due to compliance. She said that Michiganders have the tools to contain the virus, but everyone needs to do their part.
Okay.
Yeah.
Well, okay, so you mentioned that variants is one of the causes that infection numbers in Michigan are so. What are the statistics when it comes to the COVID-19 variants in Michigan?
So Michigan labs have identified 2,753 variant cases across 62 counties, according to Khaldun. Michigan has confirmed positive cases of 3 different variants of COVID-19. These are B.1.1.7, B.1.1.3.5, and the P.1 variant. The B.1.1.17 variant was first identified in the United Kingdom, has been found in thousands of Michiganders. The B.1.3.5 variant was first found in South Africa, and multiple cases have been confirmed in Michigan. The first case of the P1 variant from Brazil was identified in Michigan earlier this month.
Thank you so much, Lou Aquino, Grand Rapids, Michigan. Be safe out there, okay? Up next, updates from Edmonton, Alberta, and gardening tips for beginners. And tonight's roundtable, if we have time, it's about veggies. Eagle News America will be right back.
Innovation, digital disruption, globalization. Startups, micro, small, and medium enterprises, as well as large corporations, all face interesting challenges in the market today. Peek into the world of exciting opportunities and partnerships to drive growth with the latest business news and information. We are open for business. Your weekly dose of entrepreneurial inspiration to update you on the latest developments in the world of business. Get up close and personal with CEOs and thought leaders to help you discover valuable insights, sharpen your instincts for smart decision making with the latest markets and economic trends, disruptive ideas, global innovation, social entrepreneurship, and other leading-edge business ideas. Join the conversations to create a more vibrant environment for entrepreneurship. Catch Open for Business, from vision to action.
Congratulations dahil pasok ka na sa monthly final, Jessie this Sunday. Last week, pinatunayan ni Jessie ang kanyang galing sa kantahan as she continues her journey going to the monthly finals. Ngayong Sabado, kilalanin naman natin ang makakasama niya sa buwan ng Abril.
We had an exchange of hearts.
This is Balisan ng Galing Part 2, Singing Edition.
Welcome back. This is Eagle News America. I'm Ace Ramirez in Washington. Following lockdown orders but in bad need of a haircut, Ontario's Premier Doug Ford finds a quick solution with the help of a family member and some dog clippers. Bureau Chief Thomas Likeness joins us tonight. Tom.
Thank you, Ace. You know, I wanted to bring you a lighter side story today. This isn't big news at all in the scheme of things. It's a story about a haircut. But hopefully it's something that'll put a smile on your face as we weather the effects of the pandemic. You know, as you know, up here in Canada, we're in that third wave. The country's largest province, Ontario, is particularly hard hit. It's been shut down with a stay-at-home order. And I remember when that happened here where I live in Alberta, one of the things I couldn't get was a haircut. Reporters, though, noticed when Premier Doug Ford showed up at his news conference yesterday, he had significantly shorter hair. Now, all barbershops and hairstylists in that province are closed. So how did the Premier get his locks shorn without violating the stay-at-home order?
I looked like a sheepdog, and so we literally got some dog clippers, and I got it on video to prove it, or I know you guys are going to want to see it, but my daughter that lives at home's never cut anyone's hair in their life. I just sat in the chair and said, honey, go to town. And, you know, we couldn't even figure out how to work these clippers, and I grabbed them and zinged half my head so it's half bald on one side, and that's what happened.
Well, at least his daughter didn't keep cutting till she ran out of hair. Ford also gave a shout-out to barbers and hairstylists in the province.
But, you know, on a more serious note, my heart breaks for these barbers and hairstylists, you know, that have been shut down forever. It really does. And I'm going to do everything I can to get you back open. And I promise you that'll be the last time. As much as my daughter did an incredible job for a rookie, I'm going back to the barbers, and I encourage everyone, just please, when we get back to opening up, these people have been hurting so much as a lot of people. So please just go out when we get open. Go out and get your hair cut and get your hair styled and everything.
The province has at least another 3 weeks before that stay-at-home order is lifted and haircutters can resume working and the Premier can put his dog clippers away. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times. Back to you, Ace.
That surely put a smile on my face. Of all things, dog clippers. Why?
Well, in the first lockdown, he was talking about, because again, dog groomers were allowed to stay open, but hairstylists weren't, and he was pondering as to whether to go to a dog groomer.
Oh, that's why. I remember our discussion, the same chair, same position. We were talking about who was cutting your hair, but I think that was a year ago.
Yeah, and she still is. She still is. That's my wife. But we don't use dog clippers. We don't have a dog, so she actually got some human clippers.
That's good to know. So tell us about the situation there in Ontario, not just the hair situation, the overall.
It's pretty serious in Ontario right now. The province has become the epicenters for this third wave. Case numbers averaging more than 4,000 a day. Hospitals are ready to hang that no vacancy sign at the front door. That's how overcrowded they are. Nearly 1,900 people are being treated for COVID-19 in the hospital, a third of them in intensive care. Now, in Toronto, the shortage of intensive beds is so severe that adult patients are being sent to the sick children's hospital now, to their intensive care unit. And there's fears that there's simply not enough specialized nurses, healthcare technicians to staff these units. And then we got word this morning, a vaccine shortage has forced 2 health networks in Toronto to reduce or cancel appointments at immunization clinics. These clinics also serve some of the communities with the highest rates of infection. So it's going to be a while before those restrictions can be lifted. Ace?
So it's like one problem after the other. So what is the third wave in Canada looking like?
Not good right now. In the last week, we've had more than 57,000 new cases reported. That's a 30% increase from a week earlier. Deaths up by 17% in just 1 week. More people, as I mentioned, are being treated in intensive care units than at any other time since the pandemic began. Now, again, I want to put this into perspective. I remind you, our case numbers might seem small to our American viewers, but remember, we only have a tenth of the population of the U.S., so multiply it by 10, and that'll give you an idea of how severe it is. As far as vaccines, our immunization rate is 25 among 84 countries that have a population of more than 1 million people. Ace?
Thank you so much for the updates. Thomas Likeness, Edmonton, Alberta. Let's go to the lighter side of things. April 14 is National Gardening Day. To celebrate, EBC friend Jim Sewell in Pensacola, Florida, shares with us some tips, things we should do if we want our vegetable garden to flourish. Let's take a look.
Hello, this is Jim Sewell in Pensacola, Florida, and I want to share with you my top do's for backyard gardening. We'll go out in my garden in a second, but first I want to provide my #1 do, and that is do have a goal.
My goal for starting a garden was for me and my family to eat healthy by eating more vegetables and ensuring those vegetables were not loaded with herbicides and pesticides.
Organic vegetables in the store can be expensive, so growing as much as I can in our backyard has helped us to stay on budget while getting healthy.
Since starting our garden, we always have a steady supply of fresh vegetables.
To realize my goal even more, we now regularly have plenty of vegetables to freeze, like these long beans, and we're starting to enjoy some canned treats like this yummy salsa verde and my crowd-pleasing bread and butter pickles.
Don't try to put in all the beds at once. I have about 13 beds here that are 4x4 raised beds, but I put them in all over the course of about 3 years. And a big reason for that, I knew I was going to have some beds across the back. I knew it was going to get that good sun in the morning. And I knew this wall would kind of protect it from the heat behind it. And frankly, it was something that was already flat. So I went and put a couple beds here, but I didn't put these beds in until after I kind of got familiar with my environment in this garden. You know, I made some assumptions, but the best thing to do your first year, you know, definitely put in a bed or two, but try to utilize pots. You know, if you can get some big black pots, like these, they're great. And the reason why they're great, especially when you're in a new garden space, is because, you know, you can move things around the yard. You can find out what grows best in what places. That's it. I've got this nice little compost bin that we keep in the house. Fill it up full of all kinds of garden waste. Of course, when you start growing a lot of vegetables, you're going to have all kinds of peelings and different things from all your great vegetables. Get you a bin like this. I really like this compost bin, mostly because it's going to turn your kitchen scraps and your other garden scraps, it's going to turn it into really rich, fertilized, dense soil in a matter of just a week or two. So another big do is to plant thick and then thin. And one of the good reasons to do this is, especially if you're trying to grow organically, is that the bugs, you know, they might get a hold of your plant and you might lose a lot. So if you have a lot growing, there's a good chance that, you know, the healthiest ones are going to be able to withstand the bug, and then you can kind of get rid of the ones you don't like. Another great thing is that a lot of plants, the smaller they are, the more nutrient dense they are. Seems weird, but it turns out that those tiny little lettuce leaves or those tiny little spinach leaves have more vitamins in them than the bigger ones. And they refer to them as microgreens. So another good reason to plant thick and then thin is that you can kind of eat as you go. It's like you get multiple harvests. You start eating the small stuff, put them in your salad, and it gets a little bit bigger. And it's like this aromat. I'm going to go ahead and, you know, pull some of this stuff out, but I'm going to keep some of the leaves, and I'm going to go ahead and use them while I'm thinning this pot out because they're just getting too crowded. But honestly, I can keep things growing year round, and that's a big do. Keep things growing year round. There's really no reason to have this planting season and a harvest season, especially when you're just in your backyard and you're providing for your family. So I keep something growing year round. Down here we have water spinach that's been growing, and you know, I just put it in here a couple weeks ago. And I just put it in here a couple weeks ago because I've already got a harvest of snow peas from it. And before that harvest of snow peas,
I actually had from the fall, I had some gailan growing, which is like Chinese broccoli. So this has really just been producing and producing for it. Also, try switching up your timing. So that's another big do. Here, I'm so proud of my cucumbers. I got them in early, and it's really paid off. In previous years, I tried to put them in around, the first part of April, and the bugs just start getting to them before they can start producing. These plants are producing like crazy. I planted them at the beginning of March, and I just wanted to share this with you. Look at that. That's beautiful. Wonderful cucumber. Can't wait to make some good tzatziki out of this. Is to try to put a variety in my bed. So even in this small space right here, I've got watercress, I've got some onions, I've got cilantro, and I've got these nice cucumber plants. Now, there's a little bit of planning involved because my son's coming in this direction, because over here is the south. So the planning part is the small plants go in front of the tall plant. Otherwise, what would happen? The tall plants would block the sunlight. But a big reason to plant multiple things in a bed is, frankly, it confuses the bugs. If you think about it, if you're a bug and you love watercress, you're probably going to work your way all the way up this row. And if there's another row of watercress next to it, bam, the buffet is still open and they're just going to keep on eating. Watering, very important. And it's really important, especially, here in Florida, where it gets really hot and we have this sandy soil that even if you put a lot of compost in, it's not going to absorb or keep water down low. It's just going to let things drain out. So it's important to keep an eye on your plants. Make sure they're not wilting or looking sad. I've got a limited space. So what I really want to do is try to utilize as much space as possible. I mentioned the cucumbers, the tall plants behind the short plant. But these are some long beans. Love long beans. Oh, they're so great. And they're really easy to grow. You can see this plant's already starting to produce, even though it's very young. But I put these trellises in, and this gives me a whole vertical space. And I still have room down here for tomatoes and a little bit of eggplant. So it's a great utilization of space. It can actually be really good for the plants. It keeps things off the ground. And frankly, with these long beans, they love it. They want to have that tall space. Hopefully these 10 tips will help you to start your own backyard garden. And stay tuned to Eagle News for the top 10 don'ts for backyard gardening. Pensacola, Florida, Jim Sewell, Eagle News. We live in interesting times.
Thank you, Jim. I think it's going to be salad for dinner. As always, at the end of every broadcast, we do not forget to recognize the efforts of our healthcare workers, first responders, and essential workers by giving them a round of applause. Thank you for being our modern-day heroes. That is today's Eagle News America. Thank you for joining us. I'm Ace Ramirez. We live in interesting times.